and vaccine procurement as well. AstraZeneca's COVID-19 vaccine is the first to be approved by the nation's Ministry of Food and Drug Safety. It has been cleared for use on all adults after evaluations from 3 advisory committees. But the results of a third trial being held in the U.S. also need to be submitted. Meanwhile, health authorities are also toughening guidelines as well. Let's go straight to the scenes as they are ready for the briefing.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 11th. As of today midnight, we have 467 new local infections and 37 new imported cases. And the current caseload now stands at 82,434. And yesterday, a total of 81,200 tests were conducted, and in the metropolitan area's makeshift testing centers, we carried out 41,275 tests, and out of them, 87 people have tested positive for COVID-19. And we also have 412 more people having been discharged, while 8,300 still remain in quarantine. And there are 170 patients in severe or critical conditions. We had 10 additional deaths. And I extend my deepest condolences to the deceased and the members of the bereaved families. And next, as of February 11th midnight, here are some updates of the domestic infections here in South Korea. In the metropolitan area, we have about 82% of the cases, meaning that we have 383 cases located in the metropolitan area. And in Seoul City, Yongsan-gu district, in relation to a gathering, we have 46 additional cases, and a total of 47 have been confirmed. And also Seoul Seongdong-gu district, we also have in relation to the University Hospital 95 cases, and also 25 additional accumulated cases stemming from an Oriental hospital in Seoul City as well. In Gyeonggi-do Province, Bucheon City, in relation to the Victory Altar as well as the supplementary learning Hagwon, we also have a total of 101 confirmed cases. And also in Bucheon City, in relation to a daycare center, we have a total of 12 people being confirmed to date. And in Gyeonggi-do Province, in relation to Ansan City's manufacturing company and Islamic mosque, we also have 11 accumulated cases being confirmed to date. And next, moving on to Chungcheong-do Province, in relation to a village in Chungcheong-do Province, we have 18 accumulated cases being confirmed to date. And in Honam region, in relation to a church in Seogu district of Gwangju City, we have identified 7 additional patients, and a total of 142 people have been confirmed to date. And also in Gyeongnam area, in relation to Busan, Dongnae-gu district, in relation to a public sauna, we also have 14 accumulated cases. And in Busan Junggu district, in relation to a rehab hospital, we have a total of 38 accumulated cases being confirmed. And in relation to a care facility in Haeundae-gu district, we have 2 additional cases, increasing the total to a total of 19. And lately, in UK as well as South Africa and in the Brazilian variants, we are seeing these new variants spread globally. And also here in South Korea, we are seeing increased influx of these new variants of the virus. And as of midnight of 10th of February, we have a total of 80 confirmed new variants here in South Korea. And against this backdrop, we are also intensifying our quarantine measures to stem and to also block these further influx of these new variants. And they have been disclosed to you through the press kits, but I would like to go over them once again. First of all, we will be carrying out our intensify and heighten our capacity to also carry out these genetic sequencing analysis of these new variants. And we will have 6 more labs here in South Korea, which which will be capable of doing this research. And we will also simplify the analysis process so that it will shorten the analysis period to about 3 to 4 days from the previous 5 to 8 days. This will also help us to react to the new variants much more quickly. And as for all of the foreign entrants, we will assess the risks of these foreign countries as of these new variants. And aside from the 4 countries, we will also designate more countries with higher risks of the spread of the new variant. And also, going forward, we will also have the all of the foreign entrants from 54 African nations, and they will be subject to the same intensified quarantine measures as all of the people who are coming in from South Africa. And also, starting from the 24th of February, not only foreigners but also Korean nationals as well, all of these people who are coming into South Korea from abroad, they will be mandated to submit a PCR negative document. To this end, they will have to get tested 3 times, once before they come to Korea and also right after they arrive in Korea, and once again before they are discharged from self-isolation. As for the countries that have reported these new variants, we will also have a ban on the exemption of these self-quarantine. And however, we will have the exemptions for people with urgent needs like business, those related to businesses. And also, we will have to have all of the other people to submit another PCR negative document within 5 to 7 days before they are discharged from their self-quarantine. And we will also designate local authorities who will be also monitoring these people who are on self-quarantine at least twice a day. And the quarantine authorities will also make sure that we will monitor closely to any of the trends of these new variants being reported worldwide. And we will also intensify our quarantine measures going forward. And next, as for the R&D measures, here are some details. First of all, as for the antibody treatment and the efficacy of these treatments, in South Korea, we have developed these antibody and it is going through and it has been approved of the conditional 3rd and 2nd clinical trial by the Ministry of Drug and Safety. And as for these efficacy for 6 new mutations of the virus, we have seen that this treatment has an efficacy. And as for the new variant stemming from the South Korea, we also have been carrying out intensive research and analysis. And as for the UK variant, we have seen that the drug is effective against the UK variant. However, against the South African variant, that is, we are seeing a low efficacy rate. And in this sense, the manufacturer is also has made an inquiry of the analysis, further analysis to the US NHC, and we will also see that these further analysis on animal clinical trials will be carried out going forward. And to this end, all of the people who are have been confirmed with the South African variants, we will also make sure that their genetic sequencings will get tested and also analyzed. And as for the results and the request by the doctors, we will be giving them these drugs going forward. Meanwhile, the remdesivir treatment, which is being used as a drug against the COVID-19, we also have seen how it's effective against the new variants. And we have seen that it is effective in curbing all of the new variants, including those from the UK and South Africa. And at the National Infectious Disease Research Lab here in South Korea, we have cooperated with the private sector, and we also have been seeing an antibody substance which is effective against curbing the spread of the new variants, both stemming from UK and South Africa. And we will also embark on delivering and manufacturing a treatment which is effective to treat all of these new variants. And going forward, we believe that we will be carrying out further research in related areas as well. And as for the remdesivir, currently a total of 4,131 people have been administered with the drug across 118 hospitals here in South Korea. And as for the antibody treatment, we are also having these 18 cases which have been approved by the Ministry of Drug, and it is also being administered as well. And the quarantine authorities would also like to note that during Lunar New Year holiday, we ask you to refrain from traveling and moving to and visiting your hometowns, and we ask for you to comply strictly with the quarantine measures as well. Please note that you need to refrain from traveling and also visiting your family and hometowns. And please also remember that we have a ban on any gatherings of more than 5 people. And also, aside from the family members who live in the same residential address, please refrain from getting together physically. And please also refrain from visiting nursing hospitals or nursing homes. And please switch to non-face-to-face means if you have to meet together. And please refrain from going to multi-use facilities that are crowded and confined. And as for the ancestral grave visits, please make use of the advanced reservations, which you could also utilize online. And if you have to visit your family members and relatives, please wear your face mask at all times, and please minimize the time of stay, and please wash your hands on a regular basis as well. And if you have any symptoms, please do not visit your families or relatives and get tested as soon as possible. Moreover, when you are on the road, please utilize your own vehicle, and please do not consume any food while you are on buses or trains. And also please minimize the time you are staying at the rest areas. And after returning home, please wash your hands and also have compliance with the quarantine measures, and see and monitor if you develop any symptoms. Last but not least, I would like to underscore the following. Globally, we are seeing, according to the WHO analysis, we are seeing a downtrend of the total tally of COVID-19 patients. Moreover, as for the 5 top nations with the highest number of tallies, among them, 4 countries have seen a 10% decline in the number of the domestic tallies. And also, we are seeing that our humanity is claiming a victory against the COVID-19. And also here in South Korea, we are seeing a slow but clear downturn in the number of domestic tallies as well. And we believe that this is all possible thanks to the participation by the public. However, we believe that the quarantine authorities, we would like to note that the current situation is like walking on thin ice. And we have seen repeated cluster infections stemming from those facilities that have also repeated these cluster infections. And also, most of our cases are clustering in the metropolitan area. And it is also disheartening to note that many of the public are also going through high fatigue rate over the COVID-19. And we will be rolling out our vaccines starting from February. And we believe that social distancing is one of the most crucial aspects even after we inoculate our people. And already we have also seen many facilities where these cluster infections have broken out. And if there are no further infections stemming from these areas, we will also take bold measures and adjust the social distancing measures. However, until then, we will also carry out strict quarantine measures and monitor the situation on a strict level. And we will also make sure to contain the new spread of the new variants. And even if we have the influx of new variants, we believe that the same principle of the quarantine measures need to be abided by. And if we have the antibody treatment rolled out, we will also utilize them to our maximum. And we believe that this treatment has been verified to be effective against all of the clades that are seen here in South Korea, as well as the new variant stemming from the UK. And we believe that we will be having more similar antibody treatments going forward. And as for the Lunar New Year holiday, we believe that this social distancing is the result of our own choice. And it is very important that we have a clear decline of the COVID-19 cases after the end of Lunar New Year holiday. And we believe that everything lies in our hands. And especially in the on the SNS, we have seen an increase of the COVID-19 cases here in South Korea to 467. And we hear that many people are also switching their plans to travel. And many people would also say that they could also be exempted from these COVID-19 spread. However, note that a moment of complacency can lead to a large spread of the outbreak. And we were able to note that many cluster infections stemmed from places where we had more movement of the traffic. And even at this point, if you have not made a final decision on visiting your hometowns or traveling, please also take particular precautions and please change your plans. And this Lunar New Year holiday, we believe that sharing love is very important as well, and to share love remotely. And it is very important to note, to highlight the safety and health of your loved ones. And also, please share that to your parents that we can meet on another occasion. And especially, this is the first Lunar New Year holiday against the COVID-19, prolonged COVID-19 pandemic. We believe that it is a very difficult and challenging, but please participate in the distancing measures. And we believe that after the rollout of the vaccines, the futures, it will be very different.
That's all from us. Thank you for watching. We'll be back with our regular newscast at 6 p.m. Korea time.
We can prevent it if we stop.